Hello.
Hi, Anshu.
Hi, Sonali. So nice to be back.
Yeah. I'm so happy to be back. I missed our live sessions.
Yes, Srini welcomes you back to the
Thank
live.
you.
We also started with the live session after a very long time. So today, hello all who is going to be watching now and who is going to be watching later. We welcome you to the breastfeeding week to all the women. And so this breastfeeding week, we thought to welcome Sonali Dhole, who is a certified prenatal coach, and who better to welcome other than Sonali Dhole, who has recently been blessed with a very cute baby boy. I just saw a glimpse of him right now and 10 minutes ago. She is a new mother, so who better than her to invite on this live video?
Thank you, Anshu, for such a warm introduction. Hi, everyone. This is Sonali here. I'm a certified pre and postnatal yoga and nutrition consultant, and I also coach women regarding overall wellness, breastfeeding awareness, and also their common questions around lactation and breastfeeding. And in today's session, I believe we are going to answer a few of their questions, which we have already collected, right? So yeah, over to you, Anshu.
So one of the most frequent questions that I have been surfing on the internet that I feel women are asking is that why not go with formula? What is the benefit of breastfeeding exactly?
Hmm. Yeah. So breastfeed is considered to be the best milk for your baby. If you look at a baby's gut bacteria, I mean, see how beautifully nature has done its job. The bacteria जो होते हैं gut bacteria, वो they are meant to break down the breastfeed better than any other similar kind of milk or the formula milk. And also breast milk has the antibodies which other externally provided feed or milk may not have. In fact, it doesn't have. Okay, so breast milk is the best kind of food or milk for your newborn, for your baby.
Okay, so it's quite insightful for all the mothers who are starting out on their journey as well. That which is much better. And so the second question that is more search is when should a mother avoid breastfeeding? Because I feel that all mothers are a bit picky. And should I breastfeed my child right now? Should I do formula? So which scenario should I actually avoid in breastfeeding?
Yeah. So actually, I have met many mothers who also couldn't breastfeed their babies. So it's okay if you choose to breastfeed. I mean, not to breastfeed and choose the formula feed. But like I said in the previous answer, breastfeed can protect your baby from many kinds of short and long term illnesses because it has the antibodies which the formula feed milk will not have. And it is also seen that the breast milk can protect your baby in the future from diseases like obesity, diabetes, and also the common illnesses like asthma, bronchitis, any lung related infections as well. So that's why breastfeeding at least up to 6 months of their age is necessary.
Okay, that is also quite insightful. Mother, I feel I'm also answer troubleshooting all the questions for all the mothers out there, all the mothers that have supported She Needs so far.
Yeah.
And so on to the next one. In which scenarios when we talked about that when the child gets injections, so would it help with the pain management if the mother is breastfeeding in that time?
Absolutely. Breastfeed help with the pain management, and I mean, how? I will tell you how. Breastfeed has a hormone called oxytocin, which helps babies with sleep, And also breast milk has water and oxygen content which is seen to be reduced in babies after vaccination. So vaccination से के बाद certain लेवल तक डिहाइड्रेशन होता है बेबीज में, उनका ऑक्सीजन लेवल्स भी ड्रॉप होता है. सो उस सिनेरियो में अगर ब्रेस्ट फीड देते हैं तो इट कैन हेल्प विद नॉट जस्ट द पेन मैनेजमेंट बट इरिटेशन कम होता है बेबीज में. बेबीज कैन क्राई लेस. Babies might even fall asleep faster, right? So breastfeeding after vaccination is as good as before vaccination. So vaccination के पहले भी आप breastfeed करके जाओ, so baby you will see that the babies are less irritated post vaccination, and it will certainly help them with the pain management as well.
Okay.
Yeah.
Okay, that's nice. We can mention all these things in our customer query pages as well. And moving on, just like you mentioned about vaccinations, so I don't think medications, when a mother is on medication, they are suggested to take the child in breastfeeding form. I don't think that is possible. Is it? What do you have in your expertise?
So you mean to say if a mother is on a medication, she should
Yeah.
continue or not, right? Uh, in most scenarios, we can continue breastfeeding our babies.
Okay.
Generally, जो भी common cold and flu होते हैं उसमें तो of course continue कर सकते हो. And even during the cases of COVID, proper hygiene and cleanliness maintain करके आप breastfeeding continue कर सकते हो. I myself, when I was breastfeeding my baby when he was just 2 months old, I had got COVID. So,
Oh,
but still I continued. Yeah, I still continued breastfeeding my baby. I just maintained the hygiene and I was wearing gloves and mask, everything. So आप most scenarios में आप continue कर सकते हो. Medication पे हो तो भी कर सकते हो. Only in the scenarios if a mother is really unwell, not able to sit or even lie down, or she had a recent surgery other than her delivery, or she's undergoing chemotherapy or any strong drugs for her already existing cancer treatment. In such cases, of course, breastfeeding has to be avoided because mother का भी health बहुत important है baby के जितना है. उसको force तो नहीं कर सकते जब she herself is not well or in a condition to breastfeed, right? And but anyways, whenever you're unwell, whenever a mother is unwell, always check with your doctor. Always double check कि आप हमेशा उनको inform करो कि I'm currently breastfeeding my baby, तो मैं ये medication ले सकती हूँ नहीं. तो she or he will keep this in mind before prescribing any drugs to you. So yeah, so most cases में आप continue कर सकते हो breastfeeding.
okay. So अभी
क्योंकि
तो
breastfeeding के yeah, sorry to cut you there, because breastfeeding के just as baby mothers के लिए भी बहुत benefits है. उसमें है कि breastfeeding can reduce chances of certain cancer in mothers, especially breast cancer and ovarian cancer जो बहुत common हो चुका है अभी. Every one in like 30 women can be detected with breast cancer. So breast cancer में breastfeeding बहुत help करता है. Ovarian cancer में भी help करता है. Type 2 diabetes में भी help करता है breastfeeding. Obesity ना होने में या फिर increase या फिर weight gain ना होने में भी help करता है. Because I also deal with weight management. I have seen the mothers who had breastfed their babies at least for 6 months of time. उनमें obesity कम देखा गया है, उनमें कैंसर डायबिटीज के चांसेस भी कम देखे गए हैं, एंड इवन ब्लड प्रेशर भी it can be also maintained. So mothers के लिए भी benefits है. That's why breastfeeding it's beneficial for both mother and baby. So it should be continued.
Okay, so we have came down to conclusion that we can take medication when we are breastfeeding, and breastfeeding is way much better than formula. That concept, I hope that concept will fly, because in India not a lot of people believe in formula. Mothers are very strict when it comes to their child, so it's breastfeeding all the.
It's actually I mean the formula fed babies now India में भी वो increase हो रहा है. जो पहले नहीं
Okay.
था.
Yeah.
There
Been
can
popular.
be multiple reasons. Formula fed babies. I mean, I myself had to formula feed my babies because I had a surgery. I had a C-section. So, first 3 days was very difficult for me to even sit or breastfeed him. So, of course, hospitals I had to give him formula feed. And even after that, I continued for a certain time along with the breastfeeding. So, no harm as such, but if you are able to breastfeed him, nothing, him or her, nothing like it. You continue doing it along with the formula feed. And like you said, कि अभी इंडिया मतलब फॉरेन में of course ज़्यादा था वो because most women they start working very early. So इंडिया में भी वो हो रहा है कि मैटरनिटी ब्रेक्स अगर कम मिलते हैं, मैटरनिटी लीव्स कम है तो वो हो जाता है. But there is, I think there is no shame or guilt to be carried. Even if you can't breastfeed and you choose to formula feed your baby.
Okay.
Yeah.
So that's so on to the next question is that how long should the baby be breastfed? I think for how many months, for what time of the day, and should the if it's not possible if the baby is sleeping, should we store the breast milk?
So in newborns, like how frequently, right? How frequently and how long? So in newborns, we have to like breastfeed them in every 2 to 2.5 hours. That is like उनके hungers ही वैसे होते हैं. 2 hours में they will cry for it or they will ask for breast milk. And you can breastfeed your babies exclusively up to 6 months of the age, and it can be continued for an year or longer along with the complementary food, which we usually start by 6 months. And initial stage में उनका जो latching time होता है वो 20 to 25 minutes होता है. Okay? And धीरे धीरे वो कम ज्यादा भी हो सकता है. Some babies, if they have less hunger, they might just latch for 10-15 minutes and they are done. If they have more hunger, more appetite, वो 40 minutes तक भी latch on कर सकते हैं, breastfeed कर सकते हैं, especially during nights जब when they are like they want to fall asleep. So उस time में तो ज़्यादा time तक भी latch on कर सकते हैं. So latching period vary होता है, but at least in newborns you should try to latch them for 20 to 25 minutes at each latch. And उसको उसे भी change करना, like don't continue to latch on just one breast. You can switch to another breast and latch so that they feel fuller and they are less irritated and they can sleep well.
Okay. So that's nice. I think we got all of the questions that we needed. One of the questions that I felt a viewer has mentioned is, can we breastfeed if we are pregnant again? So
That's a good question, I think,
that's a bit
because
tricky.
yeah. Yeah, suppose, I mean, you're breastfeeding one child, your first child, and he or she has not completed 2 years and you are pregnant again. You can, of course, continue breastfeeding even if you're pregnant. It will make no difference to the nutrients which you are going to offer to your future child. Okay, there is no such thing. It's just a myth कि पहले बेबी को दे रहे हो, दूसरा बेबी आने वाला है तो nutrients कम हो जाएंगे. ऐसा कोई भी चीज नहीं होता है. Okay? And thoda like it can be little I would say uneasy for the mothers because during pregnancy, of course, you go through many hormonal changes. You can experience tender breast, you can experience back pain, lower back pain especially. So उस case में try to change the position of breastfeeding, try to use hot pads or hot packs or cold packs so that you don't experience any pain during breastfeeding. So with that, keeping those things in mind, you can continue breastfeeding even when you're pregnant.
Okay. So I think we have covered most of the questions that breastfeeding mothers might have. And I'll also take this opportunity to talk about a product that Shinita has come up with. We are I think, India's first brand. We also sent you a packet since we knew you were a new mother. It's
Thank you
Mama
so
Milk
much.
Booster. You might read it backwards, but
Yes.
we are launching a Mama Milk Booster. So as we see in today's generation, a lot of mothers are not able to produce the milk naturally. But since they don't want their child to be a formula baby, we can give them a boost with this Mama Milk Booster, and it's completely plant based. So if you can see the ingredients as well, Sonali, you as well yourself
Yes.
mentioned that you like the ingredients. They're not harmful in any ways, and they're quite natural. 100% vegan and 100% plant-based ingredients. If we have made this Mama Milk Booster,
Correct. So
and it
I mean, what I liked about the product is it takes care of your, I mean, mother's nutrients need to 100%.
yes,
Because just as baby needs nutrients during breastfeeding, mothers को भी बहुत जरूरत होता है, like calcium, folic acid, iron, इन सब का need, in fact, pregnancy से भी ज़्यादा होता है during breastfeeding. तो जो इंग्रेडिएंट्स मामा मिक्स बूस्टर में है, मामा मिल्क बूस्टर में है, it is like you said, it's plant based and it has right amount of protein, other vitamins and minerals which will help you with producing extra milk, more milk for the baby, and will also parallelly will take care of a mother's nutrients need. So that is what I liked about this product, and it's really amazing that you came up with this.
yes, and we also give a pamphlet along with the product itself. We'll be launching the product in next 2 weeks. So guys, if you have anyone, if your sister or your wife or anyone is pregnant, do let them know. Do if they need a product like this. She Need is always available with such kind of products. And of course, we give a pamphlet as well. So the new mother with many questions in her mind can read throughout the pamphlet and know how to use the product very efficiently. It won't be a surprise for her. It's all the FAQs we have, all the details regarding the products. So, Sonali, do let me know how you felt the product.
Yeah, sure. It has this, what I liked about the product is that it has these herbs which I usually recommend for the lactating mothers, जो जिसमें शतावरी है, सौंफ है,
Yeah.
मोरिंगा है और फेनुग्रीक है. All these herbs are very essential to boost your breast milk, and ये herbs babies को भी digestion में उनका I mean it makes milk more digestible for the baby. क्योंकि जो भी आप खाते हो ब्रेस्ट फीडिंग में, सारा न्यूट्रिएंट्स वो सब कुछ उस चाहे वो हर्ब्स हो, चाहे वो अदर फॉर्म ऑफ फूड हो, वो सब everything goes to your baby. So it is very important that you get the right nutrients to give the right nutrition.
Of course, that is very true.
Yeah.
So, I think we've concluded. We have covered everything that a mother needs to know. And even as a brand, even as a brand head, I would also need to know these insightful details, and I can formulate products that are much better for my customers and consumers.
Yeah. So we had a question on my
Sure.
post today, asked by Bhagyashri that how long we should breastfeed, and when we start solids for baby, is it like necessary to breastfeed, or the nutrients need for baby is covered through the solid food? So Bhagyashri, here is the answer for your question. Like I said in the beginning, that it is you should at least breastfeed your baby up to 6 months of their age, and you can continue for an year or longer along with the complementary foods. I have even seen mothers who breastfeed their babies up to 3 years of their age. So there is, it's a personal choice. Plus, it is also from the baby. जैसे वो demand पे होता है कि some babies stop by 1 year, some babies they continue for 2 years. So nutrients तो मिल ही रहे, मिल्क से भी मिल रहे हैं, but ऐसा नहीं है कि आप जब solid start कर देते हो तो everything will be covered through the solid and you can stop breastfeeding. Okay, there are still many antibodies and many nutrients and proteins, because breast milk is full of protein, fats and many other vitamins, especially vitamin C, जो काफी कॉमन मतलब इन्फेक्शंस में बेबी को हेल्प करता है, वो काफी टाइम फूड से मिस हो जाता है, बिकॉज यू स्टार्ट विद जस्ट 2 or 3 types of solids in the initial months, from the like when you start at 6 months, and then gradually you start build up, because that's how उनके बैक्टीरियाज भी बिल्ड अप होते हैं, बेबीज के गट बैक्टीरिया. सो सभी न्यूट्रिशन सॉलिड से कवर नहीं होता है. सो along with the complementary food you can continue breastfeeding. Okay, there is no such thing कि solid से पूरा cover हो जाएगा. Continue if you can, and if you are a working mother, you I mean if your maternity break is over, like we said, you can store the breast milk, you can express and store it the way I mentioned in the beginning. Okay, so no such need कि solid start हुआ तो breastfeeding बंद करो, you can continue.
Okay, thank you for knowing that. I'll keep that in mind as well. So, I think covered everything that a mother needs to know. If anything you would like to join, I think you also covered everything necessary. Let's conclude this live video so you can
I
post
just
it.
wanted to add one point though. Uh, yeah, I just wanted to add one point though. Ki, I know it's a breastfeeding week, and most many mothers are already celebrating it. Breastfeeding is a everyday thing. In fact, there's no week has to be, I mean, dedicated for it. But I know many of my friends and also mothers who couldn't breastfeed their child due to certain conditions, जिनमें काफी mothers ने breast milk produce नहीं हुआ, या फिर because of other conditions they couldn't breastfeed their child. So don't feel sad. Okay, don't carry the guilt. There is no such thing कि breastfeeding ही आपका और आपके बेबी का कनेक्शन, breastfeeding से आपके और आपके बेबी का कनेक्शन होगा. There are multiple other ways where you can still connect with your child. You can still, I mean, there are many other ways to love your child, if not breastfeeding. Okay, so don't carry any shame or guilt around it. That's the only thing I wanted to add here.
And one more thing that I would like to add is we have been seeing in social media a lot nowadays that breastfeeding in public is being banned or it's shamed as a woman. But I think it's very natural process that everyone goes through. Every woman goes through whenever they become a mother. So I feel that also we need to throw some light on the topic that breastfeeding in public is not to be shamed down.
Yeah, क्योंकि बेबीज को नहीं समझता है हम कहाँ पे.
Right.
I mean, where is the mother, right? They will demand whenever they want. So वो public में हो या घर पर हो, babies will have their own needs. So you should absolutely breastfeed. Even I mean, these days most public places or hotels or cafes has a separate breastfeeding room just as hospital. So अगर वो मिलता है तो अच्छा ही है. So that mother and the kid is both are comfortable. They are away from the noise बैकग्राउंड एंड और सबका अटेंशन से भी दूर है, क्योंकि काफी बार बेबीज अटेंशन से भी डर जाते हो, ब्रेस्ट फीड नहीं करते हैं.
Of course, of
तो
course.
उसकी भी सो या दैट्स अ गुड पॉइंट यू एडेड अंशु.
Thank you, thank you. I thought we should bring it into attention since a lot of buzz is being created.
Correct.
Okay, so thanks a lot, Sonali, for joining us on this breastfeeding week campaign and live video. We'd like to conclude and we'd like to see you as well in the next live video when we take it together.
Of course. Thanks for calling me, Anshu. It was, I really had great time with you and answering questions around breastfeeding.
No problem. You're like a Shini team now, so.
Yeah.
Okay,
then.
bye.
Bye, everyone. Thank you for joining us.